Welcome to the Sara Finkelstein Show, where the next 10 minutes can change your life. Also on Spotify, SoundCloud, and iHeartRadio. Here's Sara.
Did you know that Medicare has many, many different preventive services, which I'm going to share with you today? But first, I think it's important to go over the various parts of Medicare first, because there happens to be confusion when seniors and baby boomers reach out to me coming onto Medicare. They are overwhelmed, they are confused. That's what they tell me all the time. So let's get the basics first. Medicare has 4 different parts. Part A is your hospital portion, also covered skilled nursing facility and hospice care, as well as some home health care. Medicare Part B, as in boy, covers a lot of things: your doctor visits, your outpatient procedures, the preventive services that we're going to cover, the emergency room, and a ton of other things like lab work, diagnostic tests, durable medical equipment. Medicare Part C, ABC, Medicare Part C is what we call a Medicare Advantage plan, which happens to be an alternative to original Medicare. It replaces original Medicare. So what does that mean? Original Medicare allows you to go to any Medicare provider across the nation. That means any doctor, any specialist, any hospital, any cancer treatment hospital that accepts Medicare. You have that full control and flexibility when you have original Medicare. But Medicare Part C, which is the Medicare Advantage plan, replaces original Medicare. So it is a network-based plan. And then the 4th part of Medicare is Part D. I always say Part D for drugs. Easy to remember, D for drugs, to cover your prescription medications. But keep in mind that when you are a member of a Medicare Advantage plan, it does include your prescription medications as part of that plan. So let's delve into the many preventive services that Medicare offers. And this happens to be under Medicare Part B. Remember, B as in boy. So, for example, Medicare covers many preventive services at no cost to you, the patient. These preventive services are designed to prevent and find diseases early so that treatment works best when the diseases are found earlier rather than later, right? Makes sense. So let's go into those, and I'm going to be reading them so I make sure that I don't miss anything. Okay, Preventive Part B services at no cost to you: abdominal aortic aneurysm screening, alcohol misuse screenings and counseling, bone mass measurement, cardiovascular disease screening, cardiovascular disease behavior therapy, cervical and vaginal cancer screening, colonoscopy, colorectal cancer screening, depression screening, diabetes screening, and diabetes self-management training. Your flu shot. Grandma, who's 101, has been taking the flu shot forever. Glaucoma tests, also very important. Hepatitis B, B as in boy, hepatitis B shots, hepatitis C screening test, HIV screening, lung cancer screening, mammogram screening, medical nutrition therapy services, obesity screening and counseling, pneumococcal shot, prostate cancer screening, sexually transmitted infections screening and counseling, tobacco use cessation counseling, welcome to Medicare preventive visit, that's a one-time visit, and your yearly wellness visit. Again, these are all preventive, falls under Medicare Part B as in boy, and does not cost you anything. So I always say to clients that Medicare covers a lot of things, but it does not cover everything. It has to be medically necessary. And if you have questions or would like our free ebook, which is easybuttonformedicare.com, we're happy to send that out to you. Oftentimes, baby boomers and seniors have tons of questions about Medicare, and that's why I enjoy doing educational workshops to help people get clear about Medicare. Because, yes, it can be confusing. And if you don't make the right decision at first regarding which way you go with Medicare, you may not have an opportunity to change. So what do I mean by that? Sometimes people start out with Medicare Part C, which is the Medicare Advantage plan. And let's say down the road they want to take advantage of the benefits of having original Medicare so that they can go to any provider anywhere in the country. At that point, they do have to answer a bunch of health questions, which means what? It means that their enrollment into the Medicare supplement plan is not guaranteed. Of course, they can always go to original Medicare, but if they are not accepted into a Medicare supplement plan, which is also known as a Medigap policy, then they have to pay all of those deductibles, coinsurance, and co-payments out of their own pocket, and the sky is the limit. There's no cap to what they could be spending out of pocket for their medical treatments, visits, procedures, and so on. So again, I say the decision of which way you go with Medicare, whether you go with original Medicare or the Medicare Advantage plan, it's important to understand what those differences are, how Medicare works, so that you can make a wise decision.
Knowledge is power, but only when you implement what you've learned to your own benefit. Tune in next time for even more powerful tips on the Sara Finkelstein Show.